Joining us now is Josh Flagg, along with board-certified orthopedic spine surgeon Dr. Terrence Kim. Just a few weeks out from this.
Welcome. Did you get your slice of Spago pizza?
Oh, I did. Not only did I get it, Wolfgang sent up a whole pizza like an hour after the service. Wolfgang.
We love Wolfgang.
We love Wolfgang.
Well, and you mentioned your husband, Bobby. You, post-op, had to take care of this guy?
I mean, I didn't know the in sickness and in health was gonna come so quick. Like, right? It was like landing from the honeymoon and then bam. I was like, someone's testing.
It must have been a wild honeymoon.
Yeah, why do you think my back was out?
Is he a good patient?
Well, I mean, not really.
I think we need to ask Dr. Kim, was he a good patient?
He was absolutely a great patient, but I had no idea what I was getting myself into when he first walked into my clinic.
And it's still going on.
And it's still happening now.
So Dr. Kim, walk us through this. Anything special about his case? You were able to treat him with a relatively minimally invasive technique, correct?
Sure. So Josh, you know, all our spines have 5 discs in the low back, and they, you know, I'm a big donut fan, so I make them similar. I think of them similar as to jelly-filled donuts. These discs in your back, they have a hard crust, and they tear sometimes. And inside that jelly filling, or inside an actual disc, is called a nucleus pulposus. That squirts out. The nerve is running right over that donut and absolutely pinches hard on that nerve when it comes exploding out. And I brought an MRI of Josh's back, which he was so graciously to show.
It's a beautiful back.
And that thing is very, very, very big.
Is there anything, Doc, that we can do to prevent this?
Unfortunately, when people come and see me, the damage has already happened, and we try to fix them. But in a very important way, prevention is the key. And one of the first things I talk to my patients about is look at your family. Look at your mom, your dad, all your siblings. If anyone's got early back problems, early back surgery, then you need to know that you're at risk. And whether it's talking to your doctor about early physical therapy, training the right way, getting into core strengthening, all those little things that, Travis, you went through when you were going with your neck also. All those things you have to do.
Dr. Kim, we talk about back surgery all the time, and you know, it's a recurrent theme. Oh, I don't want to jump into surgery. But certain cases, clearly, physical therapy, rest, anti-inflammatories will not correct the problem.
Correct it. You know, one of the main things that tie a lot of people who need surgery is that severe pain. Nerve pain is one of the worst pains known to mankind. And so if you're in that situation where it really hurts, you got to get plugged in with your primary care or even a spine specialist early. The more important thing is just function. You know, Josh is out selling, you know, billion-dollar houses and stuff like that. If he wasn't able to do any of that, he was literally on the floor, you know, crying and dealing with this. And that's usually a bad sign that none of this stuff is going to work. And I actually, you know, sent him for an epidural, and that didn't even work. And so we did try as best we could to avoid it.
So you did all of those things first?
As much as we could within that short period of time, because it hit him hard like a freight train.
So if I heard you right, Dr. Kim, is the show about to be the billion-dollar listing in LA?
From your mouth to God's ears.
That much here.
I mean, Josh, those homes on Bel Air Road, it's just...
They'll keep going up and up.
You can catch Josh on Million Dollar Listing Los Angeles on Bravo Thursdays at 9 p.m. Eastern and Pacific. Glad you're feeling better.
Thank you.